Hello, I'm Judy Kurth. I'm the Director of the Centre for Health and Development, called CHAD. CHAD is a Health and Inequalities Research Unit. We look at health and social inequalities, and we believe that health and social inequalities are unjust and unfair. So they affect not just your state of health and quality of life, but also how long you might live for. So we know, for instance, that a boy born in an affluent area in the UK might expect to live for 8.4 years longer than one born in a poorer area. And how can this be okay? And that's why CHAD exists. We're here to look at how we can use research to reduce health and social inequity. So our vision is to be locally relevant and internationally excellent. But we can't do this on our own. So health and social inequalities, it's a whole of society issue. And we believe that it's only by working with local people in partnership that change will happen. And we aim to involve the whole of the university, local government and public bodies and the community in everything that we do. It's through high quality research that we wish to advocate for change within public services. We hope to be able to support people to have a voice and control over their own lives, to say what matters to them and to celebrate the things that they do to improve lives. And this is often unrecognised. And this is where the big community conversation came from. Talking to colleagues in 1000 Lives, in My Community Matters, engaging other groups such as Assist and Vintage Volunteers, we came together and developed a true partnership. And last year we came together and held a big community conversation to enable people to tell their stories, and we had over 170 people come along talking about what matters to them, and it was incredible and really moving. So from the big community conversation last year, three main themes emerged from people's stories, and they included inclusivity and having a diverse community. This is what matters to people here. Accepting differences within our community, promoting cohesion and involving everybody, and having understanding and respect for each other. Supporting each other was the other key theme that came through, alongside togetherness, and that ability to come together as communities and neighbourhoods and improving communication and interaction between generations and providing communities with a voice. So they were the three themes, but what really stood out was people in Stoke-on-Trent and Staffordshire. They want to look out for each other. And we think the big community conversation is helping to do that. And we really hope that today we provided enough activities and focus for people to do more of that, to help to look out for each other today. This year we've involved more students in helping people to tell their stories, and many of these stories will be exhibited today. We're also applying for funding because we want to be able to have more of this, have more storytelling, and over 5 years we want to enable more people to say what it is that matters to them, what difference they've made, and to really have that strong collaborative voice where public bodies will hear that and see what really matters to local people, and where people will continue to feel empowered to keep making that difference. So you're going to hear shortly from a few people who attended the big community conversation last year, and also who have engaged or put communities at the centre of their work. And so we just want to hear a little bit about what difference that has made. And it's for me now to say a great big thank you to everybody for being here today. We really appreciate that, and thank you for your support last year, and we just hope that you have a really great day, and let's keep the stories rolling. Thank you.
So my name is Amelia Bilson, and I am now the Executive Director of Middleport Matters Community Trust. We started about 2.5 years ago. I moved to Middleport. I didn't know anybody at all, but we had heard about the reputation of the area and that it was kind of a red light district. There was so much fly tipping when we were here. I found syringes out the front of my house, and condoms have been thrown into the garden. And you know, that doesn't make you feel good when you have young children. And I just really felt that I had to do something, but I didn't know what at that time. So I got in touch with the council. They have a local matters department, and I also got in touch with My Community Matters. And between them, they worked with me, sort of explained what could be done, what's possible to set up a community group and just to try and bring the community back together and see how together we can, you know, come up with some solutions. And then over the last few years we've been working so hard. The community have really responded well. We've got loads of volunteers and local businesses get involved, local schools, and together we've raised thousands of pounds and really improved the community. So we now run loads of regular activities, from creative coffee morning at the local retirement home to toddler groups to youth activities, and together we're just tackling the problems that we have, and a lot of that stems from, you know, a lack of connected community really. So I found out about the CHAD funding to do community projects, and I was really inspired actually because I'd gone to some of the training that CHAD had done on participatory action research, and we thought that that would be perfect for our community. It's along the lines of what we like to do, and one area of our community that we haven't been able to engage is our older young people, the teenagers, and we felt that this would be a way to give them an opportunity to actually, you know, take control of their area and decide on what they'd like to see happen. So through the CHAD funding we were able to bring in Wavemaker, who are a maker organisation. They'll do anything that you can make, they can do it. So whether it's 3D printing to laser cutting to photography, you know, they can do it all. And they came out with their mobile van, and because we couldn't engage with this age group, we said to them, just come out with your mobile van and park it on the street, and people will walk past, and you know, your job is to help us engage them. And that's what we did. So we had some young people come along and they did 360 photography, and they mapped it out in their community, you know, where they'd taken photos, and we're starting to build up a relationship with them where we hope that will lead to reduced antisocial behaviour and increased participation in schools and things like that, because in this area that's quite prevalent. So I'm really excited to see the outcomes of our project with CHAD.
I'm Helen Wood. I work for Staffordshire Fire and Rescue Service, and I'm Business Development Manager for Safe and Sound. We got involved with CHAD via Becky, our Chief Executive, who attended the big conversation last year and came back and spoke to us about getting in touch with Judith from CHAD to talk about doing some evaluation of Safe and Sound. Safe and Sound is a 5-workshop delivery model where we deliver workshops in conjunction with other partners to all age groups across the county. With CHAD, we specifically focused on our Hanley delivery, which is for Year 6s, and they come to Hanley in 2 sets, 2.5 weeks in September and 2.5 weeks in February. And we get the children to the fire station and we run 5 workshops for them. So we have Stoke City Council delivering alcohol awareness sessions, DHL deliver truck and child safety, fire service do fire safety in the home, police do antisocial behaviour, and Changes do an introduction to mental health and wellbeing. So all the children that attend, and there were over 2,500 over the 5-week period, go around the 5 workshops. We do a questionnaire quiz at the beginning and another one at the end to measure learning while they're there. And then what we've done is CHAD have had all that data from us, and they're using that to put together an evaluation. They're also going to go back into schools and talk to the same children that did the quiz and get them to redo it 3 to 4 months later, so we can have a look at retention of learning. And they're also going to talk to parents and see whether the attendance at the Safe and Sound event has had any impact on their child or changed any behaviours since attending. With the CHAD evaluation, we've specifically been involved with the Year 6s. Across the county we've done Year 6s, we've also done some Year 5s in different areas. We've also done some events for over 60s, and we've done some events for apprentices. I think by working with the partners to deliver Safe and Sound, we're helping the community to become more resilient, have more knowledge and more information to make themselves safer in their day-to-day lives. The Fire Service's aim is to make Staffordshire the safest place to be. So anything that we can do as Safe and Sound to help our communities do that has got to be something that's worth doing. And the outcomes that we're getting show, with the work that we're doing with CHAD, that that's the way we're going. We are helping our communities to do that.
Chris Grant. I'm chairperson of East Fenton Does Matter Partnership, and we're a community resident association.
Alice Williamson. I live on King Street in Fenton, just do litter picking because it's quite sick that I've had surgery.
And I'm Albert Williamson. I do the same litter picking on the King Street area, the all First Street and the fields up the road.
I'm Jeff Cooke from Karen Street and I'm with East Fenton Community Partnership.
There was a consultation, I believe, in 2015, 14-15, with the City Council and My Community Matters. And they identified a need to start a community group here, going by what they've seen with litter pickers doing on their own initiative, trying to keep the area clean. And that's what brought my group into existence.
Then I went up to Stoke University and designed this posting, and the council now put added extras to it, and they are having properties made for the old area.
What we found out is that there is a lot of fly tipping going on in the area. Ones will see litter pickers picking stuff up, and then, you know, within hours the rubbish is all over the floor. The next day they'd be kicking over the bins. But what I found out is that it's all related to the drink and the drugs problem. So this is what we're fighting against, and hence the reason why we have our meetings once, first Wednesday of every month at Impact Boxing, is to get the council involved. And the council also has donated this notice board as well. So we are trying to raise the awareness of not only litter picking, but also what else the community can get involved in. So we're trying our best to empower the community in saying, well, you don't have to put up with certain antisocial behaviour. You can come along on our meetings. Hopefully in the next few months we are hoping to do a newsletter which we're hoping to post for those will have various numbers regarding antisocial, if they've got any rubbish that they need to clear out of their own home or garden, they can contact the council.
So I'm Sarah Page. I'm a senior lecturer in sociology and criminology in the School of Law, Policing and Forensics here at Staffordshire University. So the CHAD funded research project that I'm presently involved in started out of community conversations. So as a woman who was on maternity leave, I ended up having lots of conversations with mums out in the community at playgroups, and also had conversations when waiting for doctor's appointments for scans of the baby and things like that. And as a result of those conversations, I was getting a strong impression from younger mothers that they weren't interested in breastfeeding, and that part of the reason for that was that they saw their breasts as the belonging to their partner. So the sexualisation of the breast was an issue for them and a stumbling block. So at the point that they were making a decision about breastfeeding, it was almost like that was too late. So the question that started to come in my mind was, how do we influence young women at an earlier age that breastfeeding is about feeding a baby and the breasts aren't about a sex thing, they're about a feeding thing. So that kind of stemmed an interest in wanting to do some research in this area, and I then had some conversations with Public Health based at Stoke-on-Trent Local Authority and talked to them about my research ideas, and they said yes, they would be interested in doing some collaboration work. And at the same time as we had that conversation, CHAD launched information about their small funding grant opportunities for doing pieces of research that tackled inequalities in some way. And so that's how we involved public health and ourselves. My research interests include looking at the sociology of health, and so that's how it kind of all connected together. So in terms of our project design, one of the things that we're really passionate about within the sociology team is involving students in research projects. We want to build research capacity and capability, and also improve employability of our student population. And many of our students are based in Stoke-on-Trent and relatively local, so we want to support the local economy with that as well. And so one of the things that we have done on this project is we paid for research assistance from our student population. So we've had 2 undergraduate students involved in the work, one third-year student who did it as part of her dissertation studies, and a second-year student, so she was able to mentor that second-year student and help her in preparing her for her final year. And then our third person, who is a paid research assistant, is actually one of our alumni students who is in the situation of being unemployed at the moment, and it gives her some work experience to be able to then apply for future jobs. And when she did her undergraduate dissertation with us, that was on breastfeeding. So that was the way that we engage students. We felt that it was really important because we wanted to look at young people's attitudes towards breastfeeding, to have a peer approach. So by having some students that are undergraduates, there would be a connection with our research participants by being able to say, we're a student, you're also a student, whether that be in school or whether that be in college or university. And so that there would be that connection point with people sharing about their views on breastfeeding.